I'm your nurse, Caloris, and I want to do a cardiovascular assessment on you. Now, in doing that, I am going to ask you a series of questions. Is that okay to do that right now? Okay, well, thank you. So then, what I'm going to do, I'm going to go ahead and I'm going to sanitize my hands. All right. Could you give me your name and date of birth and your age? Okay, so I've compared that with your bracelet. Alrighty. Do you have any heart problems? Okay. Do you have like pain in your chest? Or, does it go to your jaw or stomach, back, neck? How about any shortness of breath? Okay. You have any changes in your skin? In the pallor, or is it blue? Turn bluish sometime? Okay. What about swelling in your legs or in your feet? Any weight gain? Do you have a cough? And you don't have any pains in your legs, right? Do you have any open areas on your legs? Okay. Anyone in your immediate family? Do they have any cardiovascular problems or hypertension? Do you smoke? Okay, so we'll go ahead and begin now. So what I'm going to do, I'm going to go ahead and raise your head of your bed. Um, I'm going to do it, between a 30 and a 45-degree angle. I am going to stand to the right of you. Okay, and what I'm doing is I'm inspecting your skin. Um, any cyanosis or pallor is what I'm checking for. Okay, then I want to check your level of consciousness. So can you tell me who is the President of the United States? Okay, and what year is this? Yes, okay. Now, could you turn your head for me to the side? Okay. And what I'm doing is I'm checking to see, I'm inspecting her jugular veins while her head is turned to the side. And okay, and then I'm going to do the same thing with the other side. Okay. So we have no jugular vein distension, and I do see little visible pulsations in the carotid area. And lower your gown. I'm just checking PMI. Just an idea there. Okay. And I see, the symmetry of your chest movements, and it's visible. So then we're going to move on down to your upper and lower extremities. And what I'm doing is, again, I'm going to check for the temperature. Okay. I'm going to check your capillary refill. Okay. Same over here. That's very good. I am going to do the same thing with your legs. So we've got your gown lifted up, starting right above your knee. I'm working my way right on down, and we're checking it. And I'm going to do the same thing as far as the capillary refill. Okay, then we'll do it again over here. Okay, I'm looking any pallor. I'm checking edema. Your hair distribution on the extremities. Now I'm going to go ahead and I'm going to start palpating. So what I am going to do is I'm going to go ahead and put on my gloves now. Okay. I'm going to check your carotid artery. I am going to, there, I'm going to a little groove. And, okay, and then I'm going to do the same thing over here. Locate it. Okay, and I go into a little groove. Okay, and then from here, I'm going to go ahead and check your pulses. So we're going to go in and get your brachial. I'm going to fill that there. I'm going to go in and I'm going to fill it over here, brachial. Okay, then I'm going to check your radial pulse. Okay, and I'm going to check your radial pulse over here. All right, and we'll go on to your femoral. And adjust this a little bit. Okay, and release. Okay, we'll go okay, release. I'm going to do your popliteals. I'm going to extend your leg, and then I'm going to just, yes, just like that. And then I'm going to, okay. And then the same thing with this one. Extend the leg, and then we'll bend about the knee, right behind there. Okay. Then we'll do the dorsalis pedis. So, we'll go in. I'll do the same thing with that. Okay. And then we'll go in. I'll do the same thing on this side. Okay, now for the posterior tibial. So I'm going to go in here. It's almost like the inner ankle, so we'll go in. Okay, now I'm going to do the opposite hand, and we'll check in there. Okay. Now I am going to auscultate your heart sounds. So with my clean stethoscope, I've already cleaned the diaphragm, cleaned the whole thing. And we'll go ahead and I'll go to the second intercostal space, the aortic valve. And what we'll do is we'll listen. Okay. And we'll go over to the pulmonic area and listen. I'm going to go down to the third intercostal space, down to the Erb's point. I'm going down to the fourth intercostal space, the tricuspid area. Then I'm going down to the mitral, and here I will for a whole minute. Okay, and I've identified your heart sounds, your S1 and S2, and I do thank you for that. What I would now do is, okay, we'll go ahead and adjust your gown. I'm going to go ahead and sanitize my hands, and that would complete our cardiovascular assessment. Thank you.